Greetings and good morning, Milwaukee. Welcome to Community Heartbeat. Community Heartbeat is presented by Outreach Community Centers and it is health centers. And it's not just a show, it's a movement dedicated to bringing our community together through wellness, keeping your heart pumping with positivity. I am your host, Ebony Solly, and I'm excited for this episode. We have Men's Health Month. So if you listened in a couple weeks back, we were talking all things men's health and wellness. And since I'm not a man, I got a couple guests coming in at the top of the next hour to talk health with me. One is from Outreach, and then we've got a community staple who's been here working and serving for many, many years. So I'm excited to share with them. This is also the halfway point of the year. So, hey, thank y'all for welcoming Outreach Community Health Centers to the airwaves. And we hope that we've been able to provide some quality information for you to use and feel better. So, just a quick review of where we've been throughout the year. We've talked, our intro show was about just the services that are offered at Outreach Community Health Centers, which provides primary care, behavioral health services, dental, community services, and a pharmacy. Also, the following month after that, we talked heart health and what you need to do to keep your heart healthy. We talked nutrition and women's health, bringing healthy babies into the world, and then mental health and where we fall in not only adult mental health, but youth mental health. And so today we're talking men's health. And if I can just start with like a love letter to the men in my life, the reason we nag all of you all is because we love you, because we care. We want you to be healthy and we want you to be here. So talk back to me, Milwaukee, this morning. If you've got a man in your life that you had to just nudge to get checked in, get checked out, 414-444-5250 is the number to chat with me this morning. So first off, the dads. This month we celebrated Father's Day. Those who act as father figures, those who may have lost their fathers, and those who are standing in those father roles. We love you. So we want you to go to the doctor at least once a year, at the very, very minimum once a year. And don't let funding, don't let affordability be the reason that you don't go in. We talked briefly about last month or this month about which test to get. So we'll talk a little bit about that again, just to make sure you know what to be asking for and advocating for your health. So for those dads who are raising daughters, especially, your daddy's girls need you. So we need you to do all the positive things and continue being a role model. To the brothers and cousins, you have no idea how impactful you are. The things that you will teach this world, the positive influences you have. And listen, we know it's not without challenges, and we'll get into the debate and how that relates to health and wellness. But we know the challenges that you're facing, our cousins, our brothers. And so we hold you up, but we have expectations of you. We want you to be well. We want you to be healthy. We want you to go in and get checked out. And to our husbands, listen, although we may nag, although we may call you out and probably tap dance on that last nerve, it's because we have families and legacies to build. So we're nagging you for a quality purpose. So to all of the men in the world, dads, husbands, brothers, cousins, know that we love you, know that we're lifting you up, and we want you to be healthy and continue to be well. That's not only in physical, in mental, emotional, and spiritual health. So Community Heartbeat is meant to bring these hot topics together. So I got a confession. I did not watch the debate last night, but I did get the notes and I did watch the clips. And I'm disappointed, y'all. I'm disappointed that this is where we have found ourselves. I'm disappointed that the conversation is no longer about governing people. It's about the pot shots and the quick clips of how low can you go. We really need to return to quality conversations that are moving populations forward. I like to say I don't really have time for nonsense and I really don't entertain it often. Bickering is not helpful. um, going back and forth, and it's very childish. And so the fact that we are paying politicians out of our tax money, we are encouraging them through our private donations, and this is what we have arrived to. It's really disappointing. It's disgusting. And I think we have to change it all. We cannot continue in this pattern. And for those of you that may have forgotten history, empires can fall. And so if you think that the United States is so very strong that it is not in a position where it can be overtaken by other governments, it can be overtaken by other countries, you are woefully and wholly inaccurate. So some of the conversations that came up last night in the debate as they relate to health, Medicare and drug pricing, reproductive rights obviously are at the forefront. And I'm curious, because it is Men's Health Month, and reproductive rights seems to be such a hot button topic, and it's clearly a concern for everyone, whether they are in the reproductive stages, whether they have the ability to carry a child to term, whether that's their gender can carry a baby to term. They seem to have a lot of opinion. So when it comes to things like reproductive rights and as it aligns to men's health, I'm curious as to why the conversation around vasectomies is not more prominent. You would think that if people are very concerned about people having children, unwanted pregnancies, birth control access, you think that the ability, the possibility, the availability of things like vasectomies to reduce pregnancy will be more of a conversation. And I just haven't heard it. If you have a reason why that, or you know why that hasn't been a topic of conversation, give me a buzz, 414-444-5250. I would think that that's a conversation that should also be had at the healthcare level. So you should be having that conversation with your doctors. I get it. Not everyone wants to have children. Not everyone wants to build those families. And that's totally fine. But then take those steps to make sure that the onus is not only on women to uphold that component. You've also got drug pricing. So I know the conversation around the weight loss drugs and the prices thereof have been topics of conversation. So drug pricing came up last night during the debate. For our pharmacies, if you haven't been watching the news, Walgreens put out a statement yesterday that they're closing up to 8,000 additional pharmacies throughout the country. So when we look at drug pricing, when we look at the availability of life-saving drugs, and then we look at the availability of pharmacies in our neighborhoods, we are headed towards a serious problem. Now, Outreach Community Health Centers does have a fully functioning pharmacy. We do have the 340B pricing. So that means many of the prescriptions that are available, not only prescriptions, but over-the-counter medications, are significantly reduced in cost to patients and to the public. So our pharmacy is not only for patients, it is open to the public. But we have some serious concerns that are coming down. So we need to figure out how to place more pharmacies. As we've got an aging population, we're going to need medications no matter how you slice it. So I challenge you all to listen to what people are saying. Listen to what these politicians are sharing with you, because they're telling you exactly what they're going to do. And I argue often about with some friends on the other side of the aisle about how politicians move forward. And one of the things they always shoot back is me is Republicans will tell you exactly what they're going to do, and then they're going to do it. So when they say they're going to cut pharmacies, when they're going to cut funding allocations, when they say they're going to reduce spending in categories that matter to us, they mean it. And so that means reducing funding for the things that we care about. And they do it. And then that's when we begin the uproar, is after they've taken the things away. You look at the state funding and how the state is treating Milwaukee with taxes. That's exactly what they said they were going to do. And now they're doing it. And so we need to be more engaged in the process before things start to be cut, before and listen to people as they're running. Not only the commercials. I know that's the easy thing to do, is just listen to what the commercial, but go to their websites and look at what the literature is saying. Look at what the promises being given, and take a look at how those things are connected. Our future is at stake. Of course, Obamacare, the Affordable Care Act. And I cannot for the life of me figure out how, in a country where we are founded on principles of freedom and we're founded on principles of taking care of each other, how taking care of health of others who may not be able to afford it, I don't understand why that's a hot button issue. I do not understand why these are controversial topics. If someone cannot afford health care, somewhere, somehow, that person is plugged into our entire society, and their sickness and lack of wellness will affect us, period. And so it's up to all of us to make sure that all of us are healthy so that our system continues on and continues forward. So again, this show has been dedicated to bringing the community together, getting us to think about these controversial topics, and showing up. The other part is showing up. With everything that we've seen over the course of the past, I would say 8 years, 12 years, no one should have to beg you to come out to vote. Let me repeat that. No one should have to beg you to come out to vote. It should be on the top of your list for health, for wellness, for the betterment of our community, for the funding of the things that we all need and appreciate. No one should have to beg you to come out and vote. So let me say it now. Get up, get out, and vote. Now, June Health Month for men. It's time to focus on these health checkups. It's time to check on specialized care so that we can get you to better health. Now, earlier in the month, we talked about some of the screenings that you need. And I just want to run those down again so that I can make sure I'm doing my due diligence and my duty to bring you up to where you need to be, or to pat you on the back to say congratulations for doing the right things. So some of the screenings that you need: physical exam. Okay, so that's off the top. You need to be having that every year if you're over 50, every 2 years if you're 40 to 49, and every 3 years if you're 20 to 39. You got to get your blood pressure checked. It's way too easy to do that now. If you have a smartphone, pop into one of those pharmacies and you can get a blood pressure cuff to connect to your phone to be able to take your blood pressure and monitor that throughout the course of the month, the year. You also should be checking, getting TB skin tests, getting blood tests, getting tetanus boosters, getting your colorectal health checked. Now, I know that's not the most fun, but I challenge you, and I like to make things culturally relevant. So I challenge you to think about Chadwick Boseman. I cannot believe we lost Black Panther among his other amazing roles. So let me not box him into one individual piece, but a great mind, a brilliant talent, lost too soon, in my opinion, lost too soon because of a health reason. So for that, I challenge you again to get checked out, make sure everything is on the up and up. 414-444-5250 is the number. We are talking men's health and the tests that you need to be getting taken. Let me pop back to the debate for just a second. And I my husband woke up this morning and he's chuckling about the debate. He's replaying the clips and he's like, this is what we've come down to. And I got frustrated, y'all. I got to be honest. I'm like, this is not a joke. This is not a game. Like, this is real life. These are real things. Like, these have real implications. This is more than a political showcase. And for myself, I look at politics has become a game. Politics has become the punchline. But these are people's lives. So the funding that is coming down affects us greatly. So he's playing this clip and he's like, oh, this man doesn't know what he's saying. And this man is hidden below the belt. And so mental health and wellness for me is never a joke. It's never funny. Declining mental health is not a punchline in my book. And it needs to be something that we look at and take very seriously. Now, I won't get all the way up on my soapbox this morning, but when you have leaders that are not cognitively well, who are making decisions for our health, we need leadership and we need it now. This literally cannot wait. The other side, the demagogue, the hate spewing, is also not a good look. And so for me, the cognitive challenge on that side is people are not reasoning. People are not challenging what they're hearing. They're taking it at face value, rolling with it. And so in this conversation this morning that I was having with my husband, I'm like, people are taking the hate spewed words, and these have real implications. So I shared with him, look, you can have someone that opens fire because they've heard and been trained and have been persuaded to carry out violence. If January 6th taught us nothing, is that people are listening and people are paying attention and they're willing to act on that. So I think we find ourselves in a position where it's time to make some hard decisions. It's time to make some adult decisions because the health of ourselves and the health of our nation is at stake. So in our next hour, we'll pick back up with the debate and how the implications affect pharmacy prices and the closing of additional Walgreens locations throughout the country, how that'll impact us health and wellness. And then we'll lighten it up. I won't hit you too hard on this Friday, last Friday of Men's Health Month. In our second hour, we've got some amazing folks coming into the studio. You are listening to Community Heartbeat, presented by Outreach Community Health Centers. It's not just a show, it's a movement. We'll be right back. just a show, a movement dedicated to bringing our community together through wellness. Our first guest is in the studio with me this morning as we talk June Men's Health Month. And he is actually the reason that I am at Outreach Community Health Centers. So, good morning and welcome to Don Cohen.
Good morning, everybody.
Good morning. So, Don, I know you. I feel like most of Milwaukee knows you. But for those like 3 or 4 people in the city that don't know you, who are you? And tell me a little bit about yourself.
Well, I retired from Landmark Credit Union after 15 years working with all the community groups. And then I got bored. And a year ago, I started at Outreach Community Health Center as their fund development manager. So I'm back at it again, talking to all my friends from before and a lot of new ones.
Yes. And so you have been dedicated to this community forever, ever, as I like to say. What sparks that passion and dedication to working with the community?
I don't know. I guess I just see the need, and when something happens, like when I was doing mortgages and things like that, and helping people get their first home, and then, 20 years later, somebody comes up to me and says, "Hey, you helped me get my first home." I mean, that there's nothing better than that. And with this, I can now hope that people will come into the clinic because we have a very good clinic. I can attest to that because they saved my life.
And we got to get into that because
Yes.
that story is amazing, just in how it's all connected.
Well, 3 years ago, I had gotten COVID. That was before the vaccines came out, and I was fine. I had no problems. But then about a month or two later, I was going for a walk, and I found myself I couldn't breathe. After about a block, I'd have to stop and catch my breath, and I was having troubles. And I was set up to go for my annual physical anyway, so I just figured I'd wait, and it was one of the big box groups, I had gone in, and even though I was on the board of Outreach at the time, but I had gone in for my physical, and the doctor wasn't there that day, and they said I couldn't get in for 2 months. I said, no, that's not going to work. I was in trouble, and I called Outreach. I said, well, let me see what we can do over at Outreach. So I talked to them. They set up an appointment right away. I got in within a couple of days, and they diagnosed some problems that I had, and I did a lot more tests. And then, long story short, it ended up with a triple bypass 3 years ago. So
because you went to Outreach because the other doctor wasn't there,
right?
So it's life saving. I know we've been talking this month. As men's health is, a lot of times the woman in your life nagging, whether it's mom, daughter, sister, cousin.
Every woman in my life nags me, including
you. Have to, right? But we have to. I do nag down about everything. And that's so I like to joke. We have this Tom and Jerry relationship. We just argue like a little ball of fun. But these health implications and skipping those appointments or just not checking in regularly can have serious complications. And I can't imagine my life without you, Don, even though sometimes you tap dance on that nerve. So I'm glad you're here. And that's thanks to Outreach.
Well, and I had met you because of my work that I had done before with I was on the NAACP board as a treasurer. That's when James Hall was the president. And then you had done some work with Jasmine and some others on the groups, and I remembered your work. So when our marketing person retired last year, I said, let me see if I can get a hold of Ebony. And we did, and his history.
Yeah, it's really a labor of love. And I think someone asked me yesterday, why are you at Outreach, and do you like it there? And I think it's the connecting of the resources that are in our community with the people who actually need them. And I've never lost that. That's always been a passion of mine, for sure.
Yeah, there's such a need out there. And we have this mobile unit, which I love, and we're not getting enough use out of it. And that's why I've been pushing a lot of different organizations to try to come up with the funding to get that thing on the road a lot more. But now we're in the process of starting with Milwaukee Medical College and or Medical College of Milwaukee, and we're going to have this residency program where we're going to have over 20 residents on staff. So now we will be able to man the mobile unit, and we will have a lot more people. They're just finishing up the rehab on the building right now. So a lot of exciting things.
Yeah. So let's touch on all of these kind of individually. The mobile health unit, it is a fully functioning exam room on wheels.
Exactly.
Right now, I know it goes to one of the methadone clinics. It goes to, I want to say Pathfinders, but I may have that name mixed up. But it's out in the community at very limited locations.
Yes.
So to get that mobile unit out, you're saying that we need additional funding
Yes.
from the community.
Well, and we need additional doctors because we just don't have the staff that we can't take away from the clinic like we'd like to, because they need to take care of patients at the clinic.
Mhm.
So now with the new doctors coming in, we will have the staff
To do that.
to do that. And we've hired someone now to work just on the mobile unit and the school programs.
So we're in two schools. We're in Carmen location on 70. I can see it, 70th and
I forgot.
the street. Okay. I know, I'll look it up during the break to get you the exact address, but we have a fully functioning clinic inside of Carmen School as well as inside of HAPA, the Hmong
Right.
American Peace Academy.
And that's on 84th and Hampton.
Mhm. So it's really removing the barriers, as I like to say. So we get a lot of excuses. I don't have time. I can't shuffle all the kids to go. Now we're putting these resources right into the schools and right on the street. But you mentioned the residency program. So coming up in like a week, we have 14 new physicians that are joining Outreach. And these are physicians that are currently in their residency program. What that means is that they're already doctors. So that's the first question. People are like, I don't want to be, I don't want anyone testing on me. And these are already physicians. What they are required to do, though, to get additional licensing and credentialing is they have to study a specialty. And so these particular physicians are studying family medicine within our community. So they are coming to learn about some of the conditions that affect our communities, but some of that bedside manner, you can't approach every patient the same. So they're coming in to learn additional moments for interacting with our community. But it puts 14 new doctors in our building, which, like you said, Don, that's huge.
Oh, it's massive.
It's
And
huge.
I saw them walking around the other day, and I just, oh my God, I'm getting older. They're getting younger.
That is the shock, right? It is.
But I did ask them if they can cook, because I need an extra chef for the 27th for our health fair, because I'm going to be cooking hamburgers and hot dogs.
Yeah. And speaking of, listen, we have a full nutritionist on our team, Kelsey. So shout out to Kelsey. Her meals are delicious. She put this thing together. We're working on a video for the clinic to share what good work we're doing, and she's mixing all this stuff, just cutting it all up. I'm like, I don't know, that looks real healthy, and usually healthy does not taste. It doesn't taste like cheese and steak. But listen, she put the red cabbage with the cilantro and the cashew. I really wanted to take the whole bowl, but I tried to share. I wanted to be stingy. So we have that component of, if you just need a nudge or you need the right recipes, we've got that part is support too at Outreach. So I know I brag a lot on Outreach, but it's doing the work.
Well, it's grown a lot in the last year, and I was on the board for 7 years prior, and we were going well, but not great. And I thought we could go great, and we are moving in that direction, and we're adding people like Kelsey, the nutritionist. We've got a podiatrist. We've got even a what do you call it? Stick
Which
needles.
one? Which one?
They stick needles.
Oh, acupuncturist.
Acupuncturist.
Yeah, yes. And so it's like we got phlebotomy.
We got that too.
We've got a full lab
Yeah,
inside.
LabCorp is our partner for that. We have a dental program. Ascension is our partner for that. That's being updated as we speak. And we're going to add a couple more chairs to that area too. So we'll be going, instead of 1 or 2 days a week, we'll be going 5 days.
5 days a week. So you get that dental care.
And we have a pharmacy. So and it's going to be cheaper than, because I know I get meds, and it's cheaper than going to the big box store. So
and it's even in the small things. So I wear glasses. I have very dry eyes. I stare at a computer screen for 18 hours out of my day for the most part. Or if it's not my computer screen, it's my phone. So I use eye drops a lot. And I got to work one day and didn't have any eye drops. And literally I could not open my eyes. That's how dry they were. So somebody walked, Ebony, we have a full pharmacy downstairs. What is your problem? Go down there. And I literally went down there. My eye drops are usually 20 some dollars, right? So I have to get the good ones. They had $4 I paid for a better eye drop, actually. No employee discount. That was like everybody gets that. So yeah, we are overlooking some of these gems that are right here in our community. So again, if you are looking for a new physician, if you're looking to just make some lifestyle changes, or you need to pick up a quick medication over the counter on your way to work, stop in the outreach. It's right here in the community.
Yeah. Now we have our new building, which we moved into last September, and that's 50 some thousand square feet.
58,000 square feet.
And-
Beautiful space.
And our old section is being renovated as we speak, so that's going to look a lot nicer. And so there's a lot of things going on.
I just need to add this. I haven't been able to go into the new facility. My wife goes to outreach, and I could always come in and go upstairs and sit in the lobby in the old building. But I pull up and I say, "Hey, I'm outside. I'm outside, but I'm coming in." No, don't come in. She won't let me in the new building.
Because once our CEO just recorded a video yesterday, and she said once people come in, they don't want to leave. It is a beautiful space.
I'm coming in next time.
Just
coming
peek in.
in.
Just peek in.
Yeah.
I mean, we've got the greenery. We've got just light. So I like to joke with my friends. I'm basically a house plant. Okay, you give me water, put me by the light, I will grow. Right. Well, you got to talk to me nice too. You got to say, you're doing such a good job. But those are things that we forget.
I do not envy you. You got to put up with her
Yeah,
all day.
All
Jeez.
day.
You ever regret calling her?
Oh yeah. There are moments.
And then he remembers that life just would not be the same.
But I have to say that she's done an amazing job. And we're here because of her.
Yeah.
We're in the community because of her. I said I got tired of mentioning that when I talk to somebody and say, okay, you mentioned 16th Street, everybody knows what that is. You mentioned outreach, and I said nobody knows what that is.
Yeah.
And that I said when I started there, I said we're going to change that, and we're doing that. I think our name is getting out there well now. We're still not out there enough, but things like being here at WNOV and programs like that, and we're in the community. We're just at Juneteenth Day, and doing other things in the community. That's the key to this. You got to get out in the community and let people know who you are.
And let us know. So connect with us on social media if there's an event that you believe we should be at. One thing I thought was really great is the amount of people that have reached out and said we want outreach at our fair, so that we can share that information and put that out in the community.
Let me just add this. I know that I used to work on East Capitol, and I would always go past the facility, and I never knew the backstory, if you will, to what the facility was at that time. It was, I think you could go around back or something like that. That the new digs, of course, weren't there yet, but I don't think the story, the things that we should be, beating our chest about and really promoting. And I hear a lot of it now because I'm here and I really know the story now, but I don't think people really know, the affordability and the services, the quality of services that are offered, and the different services that are even offered at your facility. So if anything, we want to keep, telling that story.
And they will refer out to other places. Like when I had to get some other testing done for myself, I had to go to another
Right.
place. But
Absolutely.
that's fine, as long as they can refer us out and get to the next place. But and we have if you don't have insurance, that's fine.
Say that again, Don.
If you
That's
don't,
the part. That's the
Yeah.
part. That's the stuff I'm talking
if
about.
you don't have insurance, we can work with you. We
Mhm.
have a sliding scale, which is very minimal cost.
Mhm.
It's not going to be hundreds of dollars. It's going to be like $10, $20 or something. So it's really an amazing program. And it is there's 5, I believe, FQHCs. They're called Federally Qualified Health Centers in the city, and we are one of them. And I think we're going to be the biggest eventually.
One of the things I'm really happy about, not that I hopefully will ever need it, but your vending machine in the lobby there that folks can just come in and partake of, Narcan, different things that are offered there.
And that's all free. So
So medicine bag locks. So if you're taking a prescription opioid,
locks.
gun
locks,
locks.
yes,
Gun
locks.
locks.
Yeah, and this is all free. It's right in our lobby. It's in a vending machine. You can just go in and take it.
You don't have to check in with anyone. You don't have to say, "Hey, I'm here to get some Narcan." You just walk in, smile, and go right to the machine, get what you need, and then you can head out.
It's awesome.
Yeah. So things like this, we hope to continue expanding in the city. You can always call Outreach Community Health Centers 414-727-6320. I believe the line opens at 8 a.m. So I just want to make sure if you're calling before 8 a.m., the lines won't be open. But 414-727-6320 to make an appointment, to find out more, and just to get connected.
And if any of you have an extra $1 million in your pocket, I will be happy to help you with that.
That's that fund development side, right?
I have to throw my plug in.
We love it. You are listening to Community Heartbeat, presented by Outreach Community Health Centers. And as you can see, this is not just a program that we're putting on. This is a movement, and our movement is dedicated to bringing the community together through wellness, keeping your heart pumping with positivity. So as we start to look at our programming on WNOV for the next 6 months, I would challenge you to share with us your wellness programming, your upcoming events, any community health screenings that you want us to be a part of. When we were at Juneteenth, I looked up, and our new residents, so some of the 14 new doctors that will be there, are there doing blood pressure screenings. And there was one story I'll share just very briefly. There was one gentleman that came over. His blood pressure was extremely elevated. And y'all, it was hot out there. I don't know if everybody out in Radio Land was there, but it was hot, quite hot. But his blood pressure was really elevated. And this particular physician sat with him until she could bring that pressure down a little bit, and was really ready to kick up the urgency level to make sure that he was okay. And for me, it's those small little things that show how you do everything. And so the fact that she was willing to say, look, you're not going to get sick on my watch. Even if we're at a health fair in the middle of the street, we want to take care of you. That was something that kind of moved me. So that's what you get at Outreach Community Health Centers. And we're excited to see you and meet you. So come on in and get connected with us. Anything else, Don, besides $1 million that people can do to get connected?
We have our health fair coming up on July 27th, and we are still looking for some vendors yet. We have, I believe, 6 new ones that we've never had before.
Yeah,
it's the word is getting out, and we can have a booth for you for as little as $350. Basically covers our cost of the tents. So, because that's not cheap. Everything there will be free. We'll have backpacks for the kids. In fact, they should be delivered today.
Oh, this is exciting. We got a DJ coming.
400 backpacks coming, and
they're full of school supplies, right?
Yes.
So it's not just the empty
and as a little bonus, we will have some things. We have a deal now with Amazon where we receive some of their overstock and return goods, things like that. So a lot of health hygiene products. These are all new. They're not opened. They're and cleaning products, laundry detergents, things like that. We will be giving a lot of that stuff away at the health fair as well.
You said giving away?
Giving away.
We're giving it away. So people can just pop in. They can get supplies for the kids' upcoming school year. Get cleaning supplies for the house. Get a burger that Don is cooking himself. Yes. I hear he's a good cook. I don't know. He's a good cook. So come on out Saturday, July 27th from 11 a.m. to 2 p.m. Totally free, totally open to the public. If you are looking to be a vendor at the health fair, please give us a call, 414-727-6320. Ask to speak to Don, right? He's the man. He'll get you all set up. I am hopeful. I believe we might even have 860 there broadcasting live. So that's fun. I know we'll have an amazing DJ to keep the spirits up and moving. So it's just gonna be a fun collaboration the whole day. And
it's not gonna rain.
It better not rain. We're doing an appeasement to the heavens to make sure that we don't get rain. So I hope it's a beautifully sunny day, but not as hot as Juneteenth. Listen, I sweated out of my skin, y'all. It was danger zone there for a minute. I got in my car and it's at 100 degrees I said, what? I probably drank like 3 gallons of water and sweated out 2 gallons of water. But it was definitely a showcase of fun, family. I think my cheeks hurt the next day from smiling so much, seeing all my people. So it was definitely a good opportunity. So I hope you have fun at this year's Juneteenth. Definitely look forward to seeing you there next year. So Don, before we go to our next break, which will be in a couple moments, I just want to talk some statistics and maybe what women can do as women are listening, and what men need to do to just kind of nudge in to get those checkups, to get those health and wellness checks. So the top 3 causes of death in men are heart disease, cancer, and accidents. So like unintentional injuries. Although I add a little bit of levity, I think of like someone trying to carry up a couch up a stair and then it falls, and then that's unintended injury. But what can we do as women? Because you say we nag, which we do. How do we get you guys to get in and get checked out?
Well, I think you got to just sometimes the wife or the mother or somebody notices things about you that you don't notice about yourself. It's because you're living with yourself every day, so you don't notice the little things that are changing. But if you hear something or feel something in your body or hear something in your body, don't dismiss it. It's like when I first felt that losing my breath a little bit, and I thought, well, it'll pass. Right?
Yeah.
And I thought, no, I got to take care of this. This is not good. So you got to listen to your body and do it quickly. Don't hesitate. We'll get you in right away. You're not gonna have to wait months like you do in some of the places, some of the doctors, and some of the big, like it's called the big box stores.
The big box, yeah.
But we'll get you in right away and get you diagnosed, and we're gonna be adding all these new doctors there, and so we'll have plenty of people to take care of you.
One of the statistics that I saw as I was prepping for the show is that marriage and being married actually is associated with being more likely to get a healthcare visit, whether you have insurance or not. So if you have that person that's in your mind that's saying, or in your life that's saying, yeah, something's not right, or you used to sleep through the night and now you're getting up through the night, or I'm noticing that you're not drinking as much water, or women are keen in that, in noticing those challenges. So if your woman is telling you to get on in, don't wait. That's the key. Don't wait. Get on in.
And for you women, we have a woman gynecologist.
Yes, we do, Dr. French. Dr. French. Yes.
And, we have you covered on there pretty much all phases.
Absolutely. So, or like you said, if we don't have it in house, we know how to refer you out. So
and we have mental health programs that we offer as well. So we can do it's a one-stop shop. And what they'll do is they'll ask you when you're doing your physical whether you have any other problems. They will ask you those questions and refer you to other doctors in the clinic. So we want to take care of all of you.
Yeah. And one of the things, as Devo was saying earlier, kind of our history, it really has grown. Outreach has blossomed. So it started off being home healthcare for the homeless. Yep. And so we still every week will pack up a van and go out into the streets from Thursday to Friday overnight, providing supplies, materials, food, but just checking in on people. So don't think that health and wellness is just meant for, the folks we see every day. There's an entire population that is under the bridges and in tent cities and in park and ride lots that also needs health care. And if the pandemic has taught us anything, is that all of our health is connected. So the health of one or the lack of health in one can affect all of us together. So just something to keep in mind. But we blossomed from that, but we have not forgotten our roots. We've got the mobile health unit, and Don is ready to take your donations in smiles, but in cash, right?
Right.
In smiles, but in cash. And if you do want to donate, there is a space on the website as well. So you can donate at www.ochc-milw.org. That's www.ochc-milw.org. When we come back, we'll meet our next guest in the top of the next hour, and we'll talk a little bit more about men's health and the women who nag them get checked out. You're listening to Community Heartbeat, presented by Outreach Community Health Centers. We'll be right back. Community Heartbeat, presented by Outreach Community Health Centers. I want to hear from you, Milwaukee, this morning. We've got Don Cohen from Outreach Community Health Centers in the studio talking all things. So give us a call, 414-444-5250. So during the break, we were just chatting about how we share these health and wellness tips to the next generation. And so a couple months back, we were talking about the youth and what our kids need to do. Our kids, our community kids, they're all of us. What we need to do to demonstrate wellness to them. So I mentioned briefly to my daughter, I try to exhibit and provide tools for mental health and wellness and that emotional wellness. But Don, what are you doing to kind of pass the torch to your kids to make sure that they're healthy?
Well, my older son works for Humana. He's a
Mhm.
computer geek up in Green Bay. He just looks at me and says, Dad, it's embarrassing watching you on a computer. Just tell me, shut up.
Oh, working with Don in the computer. He's like, nope, I'm not going to type it out. I'm
No,
like, come on,
I'm
come
one
on.
finger typer, sometimes two. it grows. But then my younger son, he works at a body shop here, does the estimating for them,
Mhm.
and he actually is a patient at the clinic here.
Excellent. So it's a family affair.
Yeah, he has gout, and which he can thank me for, and I thank my dad for. But he came up there and they gave him some medication for that. So he comes in and he looks at his bill and he goes, "What is this?" It's like nothing.
It's nothing. I pay that right now.
Yeah.
I pay that right now.
So yeah, it's just again, and listen to your body, and when it says something, go in right away. The faster you get in, the easier it is. Like anything, and you catch cancer soon enough, you're gonna hopefully beat it. But if you wait and wait and wait, things get worse.
Yeah. So with you brought up something, the family history, right? And knowing, did you share with your kids kind of your health history with them?
Oh yeah. Well, in my family, we have heart problems, and we've had cancer. My father had several different cancers. So it's like my brother, who's a cancer researcher, he said it's not a matter of when, it's when, or if, it's when we're going to get cancer. So I'm getting up there, and I get nervous about it. So that's why I get checked a lot as well.
Yeah. When we think about how delicate and sensitive the body is, we all kind of have these things just right underneath the surface that if the right conditions, what we're eating, our environmental situations, the air we're breathing, the water we're drinking, if those things kind of align, it creates these issues in our body. So I like to say that cancer really is just growth. It's just what you want to grow and what you don't want to grow. So we don't want the negative things that are harming our bodies to grow. And that's really what cancer is. So paying attention to the diet, paying attention to how much we move, all of those things are extremely important. So in our next hour, we got another community great, as I like to call you all, people that are dedicated to the mission of health, the mission of wellness, but have been doing this for, dare I say, decades? Now we're talking decades.
I've known Matthew for at least 20 years. So yeah, he's been involved. He had a kids show at the time.
Yeah.
A kids news show, I think it was. Yeah. But yeah, I've been working with him off and on for many, many, many years, and we connected again once I got the outreach, and here we are again.
Don, listen, before we officially introduce Matthew Johnson, Don Cohen has a way of being very nice, but being very firm about what he needs from you. So he's like, "Hey, Ebony, I'm over at Outreach, and I'm going to need you to be over here doing marketing." Okay. And it's like, you can't say no to that.
Well, once you are in my web, and I tell this to everybody, you're not getting out, and I will use and abuse you. But what I try to do is make everybody win. Yes. Yesterday I needed a place to put the Amazon stuff that we got, and I grabbed a friend of mine that runs the zoo down in Racine, because they had a big building that we could put the stuff in and sort through it and bring it back up. So everybody wins.
Everybody wins,
and that's my goal, is to make sure that everybody gets something out of it. It's not a one-way street.
Yeah, and I think that's what the community needs. It needs more folks that are literally thinking about, how do I take my talents, but the talents of the people that are around me, and do it all for the community. So people can see that passion. So we thank you. Let me thank you publicly before we go back and tussle some more about something. I'm not even
recorded that.
Thank you, Don, for
it's on the web now, so it's out there for eternity.
Right. You heard it here first. News flash. Thank you, Don, for your continued commitment to this community and making sure now that we're all healthy and we're well and supporting outreach.
We just have to keep it going.
Somebody just tuning in would really think you guys like each other.
You would think, but it's like Tom and Jerry. If we have a common issue that we're fighting, we're teaming up and we're strong. But
the biggest fight is, she says, write something up about this, and I keep telling her, I don't write things.
He does not write. I'm like, just type me up some bullet points.
Yeah.
Sounds like a lot like myself.
Yeah,
I am not a good writer at
yeah,
all.
yeah.
And-
He's
and-
like, I'm just gonna tell it to you and you're gonna write it.
Right.
I'm like, what? So no, if you ever see us out in public and we're Tom and Jerry, just know it's all from a place of love. All from a place of love. So in our next hour, we will chat with Matthew Johnson and the connection of outreach community health centers and some of the initiatives that he is working on in his history in the community. So Debo, I think we're going to break, right? We doing a break real quick? We just did a break. So we're gonna move into our next hour. Okay. All right. So we'll wait a couple more moments. But Don, tell me, I know a little bit, but tell me, as you are out in the community and we're making these collaborations, these connections, why do you think it's important to not try to do this work ourselves? Why is it so important to have those partners?
The partners are extremely important to us, especially, like the hospitals, because people are going into emergency rooms and it's costing a lot of money for someone to go to an emergency room for a cold,
Mhm.
and they could be coming to a place like Outreach for their physicals and for their ailments and not have to go to a hospital, which is very, very costly for them as well as the hospital.
That's where you get that Tylenol for like
Yeah,
$1,700
$900.
for one little And so if I could add a little bit about the debate and some of the conversation that was back and forth, like I said, top of the hour, I didn't watch it in depth, but I did grab the clips and the news features. They're talking about Medicaid and prescription drug prices. So if we could wave a magic wand and ask the government for anything, it would be to not have $1,700 Tylenol, right? Or $900 ibuprofen, right? That would be one of the things we'd ask for. But Outreach is a federally qualified health center, which means we get funding from the federal government to take care of our community. So it's up to us to advocate for reduced costs to our pharmacy. So as I shared, Walgreens is cutting another 8,000 pharmacies. These things are going to be hard to find in our community, right? And so Outreach is kind of there having your back again with the pharmacy.
Yeah, we just redid our pharmacy, did a new look on it now, so we have windows that you can go up to, privacy windows. So we made a lot of changes in that building in the last couple of years, and it's going to continue.
Yeah, and it's really I feel like they're folks that talk the talk, but folks that actually walk the walk. So we're making the investment in these renovations.
And we have great partners too. We have Ascension, Reggie over at Ascension has been a great partner of ours for a dental program and other things. He's been very helped sponsor a lot of things. Freidert, Medical College of Wisconsin, Anthem. We just grabbed somebody from Anthem that is going to be joining our board. And she'll be a great addition for us. So we have partnerships with even UMOS on the south side, and we're going to hopefully have partnership with St. Augustine when they build that new
facility
at Stritch College. So I'm meeting with them in a couple of weeks. So there's a lot of things going on in the community, and we're really happy to be growing and being a part of it. And we've still got a lot of growth to go yet. So please come on in. We're not